Welcome to the Wellness Roundtable, a new podcast created by the Global Wellness Institute. This is season 1, Longevity, and I'm your host, Alexia Brew, an exited media founder turned longevity entrepreneur. Together, we'll explore the scientific and societal frenzy around all things longevity, examining whether it's a golden age or a gold rush. Before we get started, we'd like to thank our partner, Fountain Life, for supporting this podcast. When was the last time you really thought about your health before something went wrong? We're living in an age where science and technology have unlocked the ability to detect disease before it shows symptoms and take action when it matters most. That's the foundation of Fountain Life, a visionary longevity center co-founded by Tony Robbins, Peter Diamandis, and Dr. Bill Kapp. They've brought together some of the world's most advanced minds in medicine to flip the healthcare model from reactive to proactive. Fountain Life is redefining what it means to take control of your health using AI-powered multimodal diagnostics that go far beyond the standard checkup and inform a personalized optimization plan designed to maximize your vitality and extend your health span. Fountain Life has been a trusted partner of the Global Wellness Institute for many years, and we share the common mission to empower health and wellness worldwide through proactive medicine, scientific innovation, and technology. This is the future of healthcare, and you don't have to wait for it. So choose to live without limits. Head to fountainlife.com to learn more. That's fountainlife.com, because a healthy person has 100 dreams, but a sick person has only one. Today on the Wellness Roundtable, I'm joined by Phil Newman, founder and CEO of Longevity.Technology, the influential and forward-looking platform chronicling the science, investment, and commercial opportunity of the longevity ecosystem. Phil has a panoramic view of this emerging field. His team tracks the capital flows, biotech breakthroughs, clinical milestones, and evolving business models shaping the entire longevity sector. In our conversation, Phil walks us through the 10 levels of longevity, from level 1, where most of us now live with lifestyle interventions and diagnostics, to level 10, where consciousness may be preserved in the cloud. Our conversation is part science, part sci-fi, and all grounded in what's actually happening today. We talk about GLP-1s, cellular reprogramming, longevity clinics, and why he believes aging is a solvable problem. And not just for the ultra-wealthy. This is a mind-expanding deep dive with someone who sees what's coming and is shaping the way we measure and understand it. Let's jump in. Phil Newman, welcome to the Wellness Roundtable.
Alexia, thank you so much. It's a real honor to be here. Looking forward to our conversation today.
Me too. Where are you recording from?
So I'm at home in London, and I've been here for a month, which has been an absolute joy. I spend most of my time traveling, so I've been able to stay here and get some things done at last.
Oh, that's great. So I would love to hear a little bit about what you did prior to starting Longevity.Technology, how you entered the longevity space, and what that aha moment was for you when you realized in 2018 that this was going to be an absolutely tremendous opportunity.
Sure. Yeah. Well, I mean, I've spent my career working in early stage technology companies in breakthrough markets. So I've always been involved in sort of 1.0 technologies, moving into new spaces. And I guess that that's everything I've been doing, from clean tech to Internet of Things. I was involved in bionics for a period of time, which is quite an interesting end around to where I am now with some of the technology we're reviewing in the space of longevity. But I guess that I was looking for something that I could really spend the rest of my career focusing on. It's pretty tiring, as you know, being a sprinter to middle distance runner with all these technology companies. They don't always succeed. Some of them do, but of course it's hard work. And I guess that I decided that I wanted to do something that was completely de-risked from working with other technologies and things that other departments that I'd needed to rely on. So I guess that I thought, well, what is Phil good at? And how can I apply that to something that I would like to do for the rest of my career? And that was basically a high-level objective that I had. And back in 2018, I was reading the Financial Times on a train in Norway. I was doing a 500-kilometer, 24-hour bike ride between Trondheim and Oslo. And I was on the train from Oslo to Trondheim, and I read about the term longevity for the first time. That was a company called Juvenescence raising $50 million dollars at the time in their Series A. And it was like, wow, this is kind of very interesting. So after that, I didn't have an aha moment. That was, I guess, the kind of the spark moment. But I spent a lot of time then looking into the sector, understanding, was it a thing? Was it really something that was stable enough for me to throw myself into with my own time or my own money? And I guess I decided over a period of time in 2018 that it was. And we ran in stealth from the beginning of 2019. I took an office, hired some staff, and started Longevity.Technology from that point. And then we launched in September 2019.
I love that. So you've been in all these different sort of very future forward industries, but you decided longevity had longevity, and that this is where you were going to like focus for the long haul now.
Yeah, you've got it. And I guess that I've been in industries where I've been too early, and I've been trying to get into industries where I was too late. And I guess it was a sort of Goldilocks scenario. I was trying to find exactly the right timing, and frankly, we timed it right, and it's blowing up now, as I'm sure we'll discuss today. But it's had its bumpy times as well. 2021 was the breakout year for everybody in terms of capital flows. Then the world changed in 2021. So it's taken a little longer to get to the point where we wanted to as an industry today.
Totally. And we'll talk about that funding environment later. So I'd love to hear a little bit about the vision for the publication. And for people who don't know, what Phil has really done is incredibly analogous to what Susie Ellis did when she started the Global Wellness Summit in the early 2000s, recognizing that there was this nascent industry that needed definitions, that needed coverage, that needed frameworks, and also someone to measure the economic impact of it. So I think in a lot of ways you're doing for longevity what the Global Wellness Summit and Institute has done and is doing for wellness. So can you talk a little bit about editorially what your mission is at Longevity.Technology?
Yeah, I guess, first of all, we are not a journal, right? So we're not a scientific journal. So what we are is we're really a crossover, a daily news publication that looks at the funding activity, the scientific breakthrough, the commercialization, and likewise the innovation set against a policy background about what's happening in the macro environment. So we bring all of that together really to cheerlead what's happening in the longevity space. We publish news articles every day, and we have a benchmark of a minimum of 2 articles a day. Frankly, we could be doing 7 articles a day. But what we do is we tend to calibrate the news that we publish to be really the breakthrough activities that are really helping people understand the momentum of what's happening in the industry. And they're all deeply researched. So, of course, we reference everything because we want to be very trustworthy as a source for people. We are just about to step it up, though. And maybe we'll talk about this later as we get into the data side. We, like everybody else, are integrating data with AI agents, and we have a baseline of information that we've been collating over 5 years now. So we're going to apply that into turbocharging our news and outreach content, as well as the data that we use across the industry.
Let's talk about that now. If you can paint a little more of a picture of that would be great.
Sure. Well, I mean, we have been analyzing the industry since 2022, and I had a great researcher that joined my team. Dara and myself spent a lot of time scratching our heads, really trying to break down the industry into its component parts. We identified that there were 25 component parts of the industry. And this is everything from drug discovery platforms that use AI, cellular reprogramming, even pet longevity, because we felt that pet longevity was a very big contributor to the space as well. So we broke the industry down into 25 domains. We then started identifying the companies by domain, and some of them sometimes cross over 2 domains. And then we started to look at what was the status of their commercialization and what was the status of their funding. So what we were doing at that point in time, and as we have been doing annually, is we push out annual reports that go, okay, capital into the space has been X number of billion this year, broken down by these 25 categories, X has gone to Y, etc. But what we've actually discovered really is that now is the year 2025 that we're in a position where we can commercialize that data, because the interest in the industry has grown so much that people are hungry for access to data that means that they can use it for either mergers and acquisitions, maybe licensing deals. And I'm very excited to say that we were actually approached by a top 10 big pharma company who knew what we had, and they said, we'll work with you to develop a product that we're happy with. And then once we're happy with it, you're free to go and license it to the rest of the industry. So that's what we're doing now. So it's all about collaboration. And it's all about, really, by the inference of what I just said there, the fact that big pharma's coming into the industry as well now. And we've seen what's happened with the weight loss drugs.
Yes.
The aging drugs, when they come through, will be weight loss drugs on steroids, if that's not mixing my metaphors.
That's awesome. So, Phil, I think you guys have been such thought leaders at Longevity.Technology in creating super informative and helpful frameworks for the space, which, as you say, can be confusing and commingled. First, let's talk through the different phases. So a lot of our listeners are in the wellness space. They are sort of having that moment that you had in Norway in 2018 where they're like, oh my God, longevity is enormous. How does it relate and commingle with wellness? So maybe talk us through your longevity 1.0, 2.0, 3.0, and kind of help people understand sort of where we sit right now.
Yeah. I mean, and again, we've got a lot of definitions that we're talking about today.
Yes.
So I'm finding that I'm talking about 1.0, 2.0, 3.0, because it's much easier for people to understand that actually we are now in a longevity 1.0 economy, albeit very early stage. Okay. But we are seeing the wellness industry move around now and go, okay, well, actually, this whole longevity agenda is something that we can embrace. We can commercialize it. We've got perhaps real estate that we can apply to longevity. We've got gyms that could be upgraded to longevity gyms. We've even got clinics or luxury destinations that could be applied to longevity. So we are absolutely seeing the longevity 1.0 market now. And I guess that the simplest way of describing it is it's the healthspan industry. Now, there are some people that get a little sniffy about what's the term longevity and what's healthspan. I'm very comfortable with that, because really at the end of the day, if we can help people live their lives to its full natural progression of what it is with today's technology, perhaps you're going to get to 85 or 90 or maybe hit 100 in great health, and that period of morbidity at the end of your life is really compressed to 6 months, maybe a year, not the 15 years that we're all dealing with now, then effectively the whole wellness industry embracing healthspan at this 1.0 level will have done its job. Yeah. And then you kind of go, well, okay, where's the next phase? So the next phase is really 2.0. And these are the drugs that we referred to earlier. There really aren't any therapeutics that have been through clinical trials yet and are deployed in humans. So they're moving to the right, but they're not there yet. But these are technologies that are going to be doing a number of things. The first one is they are going to take existing aging disease pathways and they're going to tune them to, first of all, be able to prevent a disease from happening in the first place.
Now, is this since Altos Labs, Retrobio, that cohort of companies?
Yeah, they are in this category. Okay. But effectively what they're doing is they are moving up to level 7 and level 8. Okay. We'll come to the 10 levels in a minute. But effectively what they're doing is they are endeavoring to rewind aging. Yeah. So if there are a number of stages, if you can imagine. So the first thing is, can you prevent a disease of aging happening in the first place? If you can, great. You haven't got any of the downstream issues. If you do have a disease of aging, are you able to rewind it to the point where it doesn't exist anymore? Of course, the current pharmaceutical and healthcare environment, which as we know is the sick care paradigm, they're just managing aging diseases. They're not curing them effectively. They're just managing those diseases and the symptoms of them. So if we can stop them happening in the first place, or if they do happen, we can actually rewind them back, then those are really the longevity 2.0 therapeutics we're moving into. And as we just talked about with Altos Labs and so on, you've got the potential of rewinding at a cellular level, which means that you can rewind, for example, heart cells muscle cells or whatever it may be. But ideally, what you want to get to is you want to get to the point where you can rejuvenate every cell at the same time. And you're in a position there where you're starting to talk about systemic rejuvenation. So effectively, the destination would be that if we can get to the point where we can fix aging diseases and we can extend health span, then we can start to move into the concept of actually synthesizing longevity, so that you're in a position where you help people achieve longevity escape velocity, which is they're around long enough for medical science to keep them alive for another year so they can benefit for the next year. And effectively, you may be in a position where people can live beyond their genetic ceiling of 124 years.
So this vision of Longevity 2.0, is this a 2030s thing, or what time frame are people talking about?
Yeah, so I'd say it's going to be late 2020s, early 2030s by the time these therapeutics come through. Obviously, they have to go through the right regulatory processes to ensure that they're both safe and efficacious in humans. That takes time, takes a lot of money. And a lot of these companies are now moving from phase 1 to phase 2. And when they go from phase 2 to phase 3, they're going to need a lot of money to be able to prove at the clinical trial scale that they are able to be that efficacious and likewise safe. So that's where big pharma or big money needs to come in to be able to help these drugs move on to the next phase, which is why we're building all of these data sets, because obviously we know they're getting closer. So we need to help investors understand where the right bets are.
Okay, great. Now for Longevity 3.0, paint us a picture of that.
Yeah,
this is where it gets really sci-fi for me.
Yeah, I mean, it is sci-fi, but it is something that I've stayed away from for the last few years because I'm trying to help everybody keep it grounded, because this is a proper industry. But effectively, when you're starting to talk about radical life extension, you're talking about the concepts now of brain-computer interfaces and humans being able to blend with AI. And I interviewed a company, an incredible company called Subsense AI, only a few days ago. They have got nanoparticles that you inject through the nose. Those nanoparticles are both read and write in the brain. So this is real Ray Kurzweil singularity stuff. You have a head-worn device, and this device can not only direct these nanoparticles, but it can also read and write those nanoparticles. So as an example, their therapeutic pathway will be Alzheimer's, Parkinson's, and so on. But likewise, the technology can be applied to telepathy even potentially in the future, right? So we're on the cusp of this facility in humans where we can say, okay, we're actually going to be in a position where we can potentially live longer. We can maybe live to 120, 124, and maybe push it even further. If you're able to do so, then you're in a position where the world is going at such a fast pace now. You want to be in a position, in the same words as Brian Johnson, you don't want to die because all this amazing stuff is coming. And of course, in 20 to 50 years' time, there'll be space travel, there'll be off-planet habitation and so on. And of course, the longevity agenda means that people will be able to travel longer periods of time in space and so on. So this is really where the longevity 3.0, which is for some people too radical for them to consider to be a sensible part of the industry, but we actually consider that it's the next generational step. So for me, back in 2018, I'm now in that position now where I'm starting to think about some of these new technologies, and integration of neural technology is going to be a key part of that.
Fantastic. Okay, so we're living in Longevity 1.0 right now. And then within that, you have a framework around 10 levels. So I think it would be really helpful to just give people a high level on how you developed that and what that is.
Yeah, but I realized that there was a lot of confusion in the space. People conflating biotech with non-biotech, very, very deep and serious science with influencers. So I thought, okay, we actually need to be in a position where we stratify the industry so that people understand and can self-identify what level of company they are, whether it's, we're a level 3 longevity company, or an investor says we only invest in levels 4, 5, and 6 longevity. And that's starting to happen now. So what we did was we went back and said, okay, well, actually, what is the easiest way of being able to describe this to people so they can understand it? So level 1 is lifestyle management, right, which is backing directly into the wellness industry. This is all about diet, sleep, exercise, alcohol intake, stress management, all of those types of things. And of course, there's a whole industry in place for that, being enhanced by AI now, that's enabling us to not only track our metrics better, but also interact with data in a much more sophisticated way. So level 1 is the baseline of longevity. And frankly, everything else that you do will be driven by how well you manage your level 1 longevity and the products and services that you employ to do that. And that's effectively what we're seeing now. What, of course, is then level 2 is trying to understand a little bit more about what's going on inside your body. So we're seeing a big drive in consumer diagnostics, really giving consumers better markers for themselves to understand how they self-manage their own well-being and longevity journeys. Level 3 is biohacking, right? Whether you go to a biohacking gym and you get your red light therapy, or you do your cryo, or whether you do cold showers, all of the things that you are possible for helping your own biohacking regimen. Again, then this includes supplementation and all of the things that you self-manage. Levels 1, 2, and 3 are really self-managed consumer, whereas level 4 is actually kind of the breakthrough of what's happening in the space at the moment, which is the longevity clinics that are professionalizing all of the diagnostics, the management of all of the complexity around your life, whether it's your cortisol levels in the morning, whether it's your gut-brain axis, whether you've got food intolerances, you're indicating that you've got early onset aging diseases. All of these things come out when you go to a longevity clinic, and they are coming up all over the place. They're growing all around the world. And again, as this in the same way with biomarkers, we have to reflect that there aren't really any common standards across those companies, and there's no common protocols, even though a lot of them do, like VO2 max and CGMs and so on. The reality is it's kind of functional medicine that's moved into a new sphere under the tag of longevity.
So, Phil, these are doctor-run facilities, but they're sitting outside of healthcare, but they're clinical.
Correct, but they could be quite a number of things. They could be a preventative medicine clinic that's decided to rebrand itself longevity. It might be a luxury spa that's decided it's going to hire some professional doctors to run a clinical program, obviously licensed correctly to carry out clinical practice. So there's a mixed bag. We're even seeing a lot of gyms now migrating to offering the clinical side of that service as well. And of course, you then need to get the professionals on side. So what this means now is that this whole industry, you've got the complexity of setting up the facility in the first place. You've got to understand what diagnostics you're going to run. Are you going to run full body MRI, or are you just going to do ultrasound? Are you going to outsource your full body MRI, or do you see that MRI isn't required, right? And then you've got to then go, okay, so we're going to decide on what our diagnostics looks like. We've got to decide what our pricing looks like. We've got to really understand what our interventions and aftercare looks like. And we've just completed a survey of longevity clinics. We had 82 from around the world respond to our questionnaire. And frankly, they're doing their best, but of course, they're crying out for this next phase of recognition in the space of longevity protocols. They're all kind of writing their own software. So you need software practitioners to be able to develop the systems and the diagnostics that can all be standardized across the board. And it's going to happen this year to early part of next year. We'll see that really bedding in. And of course, then you go to a different clinic, and I've been to different clinics around the world. They've been wonderful, but they've all identified different issues that I should be addressing. There wasn't one that identified the same issue on 2 consecutive visits. So that sort of demonstrates that this is a work in progress, but likewise, it is a big opportunity to get it right. And it's a big educational opportunity for their clients and future customers.
And in this level 4, the other thing I'm interested in how it's going to play out is if people are going to the single point solutions like a Pronova in the US, where you go in and you get your MRI and that's it, versus some of these more full service places like a Fountain Life or Atria or Biograph, where you're getting a much more 360 complete picture. It's much more expensive. And then you've got what Daniel Ek from Spotify is doing with Nico Health, which hasn't come to the US yet, which will be even more low cost. So it's going to be interesting to see what works, or if we've just got a great marketplace with lots of different entry points.
Yeah, that's right. And of course, you could argue that a longevity clinic that just stops at being a diagnostics clinic is therefore going to be fully independent and identifying what you need to do and not making any money out of helping you do it. Okay, so if you're a diagnostics and a services clinic, where you're integrating what you recommend to your clients as interventions, whether it's very simple things like better exercise or down inflammation through cryo and so on, through to more experimental things like therapeutic plasma exchange. And of course, the point is then you're going to be able to retain your customers longer and make more money out of those customers. But likewise, you really need to make sure as a clinician that you are not over-diagnosing, because that's a big issue. So the reality is that there's a balancing act, and the whole longevity clinics industry is trying to do the right thing. It's complicated. There is a call for standards. Standards are starting to come through now. And over the next 12 months, I think we're going to very much see X clinic is certified by Y organization, and X clinics clinicians are all trained by Y organizations professional standards of functional medicine or whatever it may be. So it's going to happen. And of course, within the wellness industry, you want to be in a position where obviously what you're doing is the right thing by your clients, but likewise, you're doing sufficient that keeps the relationship going. And again, this is another experience that we've seen where you might go for 7 days of luxury and diagnostics somewhere very beautiful, but you've still got to go back to where you live and then carry on the program that you've been identified to carry on with when you leave the facility. So this comes down to telehealth, it comes down to software, it comes down to feedback loops from wearables and all of those types of things. So it gets complicated fast, and we're not there fully yet as an industry.
Okay, so level 4 is obviously very active, very relevant to the wellness space. Let's move into level 5.
Yeah, so longevity level 5 effectively is aging disease management as it stands now, right? So effectively what this is you present with cardiovascular disease. There are companies that are going to help you with that cardiovascular disease issue. There are some companies that are looking at the aging drivers that have created that cardiovascular disease in the first place. And these are the companies that are very interesting. They're more longevity biotech category companies that, as I mentioned earlier, can then move to level 6 by using the knowledge of those drivers, they can intervene earlier and they can prevent that disease from happening in the first place. So there's quite a lot of proximity between level 5 and level 6, but effectively you could define level 5 as being the current drug paradigm that we're in, which is effectively a sick care paradigm because it's helping people once they've got a disease. So moving on to level 6 is where you want to be in a position where you prevent that disease from happening in the first place. And when you move to level 6 onwards, that is in the future biotech space that we're very keen to see the fruits of over the next few years.
Okay, great.
So level 7 is what we call targeted age reversal. There's a lot of work in cellular reprogramming now. For example, if you're in a position where you can help kidneys or livers regenerate at a faster pace than they're doing, and you're in a position where you can reverse the organ back to a younger state by taking the cells in that organ, rewinding them back to a state that means that they are younger cells, they are demonstrating younger cell behavior, but they still have their cellular identity, that they know that they're part of a liver or a heart cell or whatever it may be. That is what we call targeted cellular reprogramming. And there are a number of therapeutics that are looking in that space now.
And so right now, someone can look at the biological age of their heart versus their kidneys versus their lungs, but they can't treat that different biological age. Is that correct?
Effectively, all you've got at the moment at your disposal is the level 5 drugs that are available in the marketplace today. So the cellular reprogramming companies, there are probably about 30 of them now. There are companies of all different sizes. We've all heard of stem cell therapies, right? So the stem cell therapy is really where you take a cell back to a pluripotent state, which means that it becomes a cell you can make into anything. But actually cellular reprogramming is keeping that original cell and rewinding it back to a state where it still knows what type of cell it is. And then you move on to the next level, which is level 8, which is systemic age reversal. So this is really where you are rejuvenating all the cells in the body at the same time. And of course, this is still a way off. You need to get to the organ level first. And then once you've earned the right to advance from organs to the whole body, that's the next phase. But this isn't just purely associated with cellular reprogramming. There's a lot of appetite in the marketplace for mitochondrial transplant, where you change all of the mitochondria in your body and re-energize your cells. So systemic aging reversal is really the destination that we want to get to, where humans will start to live in radically extended lifespans. If you can get to the point where every 5 years you can rewind your body back 5 years, effectively you can be around forever, right? So that's where we see the industry going.
I think there's some concern from people that these age reversal drugs are just going to be for the rich and famous. And I just think it's really important. What you're saying is, no, these are not going to be expensive, out of reach drugs. The whole point is for everyone to get them, right?
And I really, truly believe that. A, because it makes absolute commercial sense. There's only a certain number of billionaires and family offices in the world, right? You want to get to multi-million, multi-billion populations with therapeutics that are going to help people, if they choose to do so, stay independent and healthy for longer. And more importantly, to be tax earners for longer, because as we know, birth rates around the world are declining. And most developed societies have a population pyramid that's not in a great shape, right? So these middle-aged people that are moving through to older age, if countries can effectively keep them younger and protected for longer and productive for longer, then that's where everybody's going to win out. And you can see what's been happening with these weight loss drugs, the phenomena that they were. Effectively, what they're doing is that they're being used for weight loss. Now, weight loss obviously pushes type 2 diabetes and all the rest of it. But the reality is that weight loss for most people is a lifestyle condition. It's not a clinical condition. And in many respects, you could argue that getting old is a lifestyle condition, not a medical condition. And if you then take that parallel and go, well, actually, if we can help the US reach peak obesity with a combination of gyms and weight loss drugs, probably more gyms in the trajectory that they've achieved that in the US, then the same can be applied to national populations from an age and chronological age progression score, in terms of, can you be in a position where you have people in their 80s and 90s that are still highly productive and still contributing back to their societies. And I feel that that's really the strong destination that we're leaning into as an industry.
Yep. So, okay, we still have level 9 and 10, right?
Yes, I'm sorry. You're doing a great job of keeping me on track. So level 9 is a bit like, okay, if all of that's not going to work, how are we going to get to the point where we can achieve longevity, escape velocity? So this is kind of like organ preservation, organism preservation. So I mentioned biostasis earlier. So there's obviously a big imbalance in the availability of donor organs. They don't travel well. So even now, the biostasis and cryotherapy techniques that we've read about, people freezing their whole bodies, they're actually being used in much more practical clinical applications today. But the concept of being able to go into biostasis and effectively come out of biostasis through a process of, let's call it defrosting for want of a better way, that is still not here yet. But that is actually, when you consider that currently the choices you've only got are burial or cremation, and looking at the costs of that, then we're seeing now that cryopreservation, which is a derivative of organ preservation as an industry, is really starting to come through. And I mentioned earlier the concept of being able to have a cloned bioidentical body without a brain. There's a kill switch for the brain in development of these clones. That is something I only read yesterday. I think it was in the MIT Technology Review, a whole article about this whole particular subject. So there's that. There's xenotransplantation, to be able to have organ transplants from bioidentical pigs. And there's even things like head transplants. We ran an article about head transplants a few months back, but actually that's based on very solid science about spinal cord transplants. There's a doctor in China, and it's a US company now, that can do spinal cord donor transplants. And again, you go, yeah, that's kind of crazy. But yeah, actually, if you want to keep the organism alive while all of these technologies are coming through, there are some choices for people. And then, and then we get to level 10, which is the concept of being able to preserve your consciousness. And this is the potential now of where we're seeing very, very early stage integration of these technologies, as I talked about earlier. That means that there is an option in the future to live digitally as well as corporally. And I think that's fascinating.
Yes, it's pretty mind-blowing stuff when you get past level 6, for me at least. So, all right, let's come back down to earth a little bit and we'll talk about the funding environment. Let's talk about how you see the funding environment right now. For people who are outside of this, talk us through what the conversations are around funding right now and the sort of mood and vibe.
The mood is good. We're not at the peak of 2021, but nobody is, whether you're in fintech, clean tech, or whatever it may be.
Yeah.
So 2024 was 8.49 billion invested into longevity companies in that one 2024 year, which is up from 3.82 billion the year before. So it is over doubled, which is great. It's demonstrating that there's more capital coming into the space. And the interesting thing is that we're seeing, as I mentioned earlier, big pharmaceuticals are getting involved now because they need to be in a position where they've got assets that they can fund through phase 3 trials. We've also seen that there is big pharma now licensing from or pre-licensing biotech assets so that they can actually, if those assets go through the right clinical phases, that they then got a licensing deal in place. And these are $500 million licensing deals that we're seeing. So very encouraging that the market is growing. I believe it will continue despite all of the recent issues that we've had on our stock markets. But for me, I believe that it will start to increase again by perhaps 15 to 20% in 2025. There's still a lack of very, very early stage capital in the space, and the transitional capital between companies that are at seed stage and Series A stage, they need more capital as well. So we're getting involved in applying our data into a new category of fund. So we're doing a crypto-based fund to be able to actively participate in those companies as well. So we feel that there's a lot of growing optimism. It will still continue to grow. We're seeing trends now rather than just reactions to economic events that have been happening over these last 5 years.
And in terms of where the dollars are going, are we seeing a lot of dollars pouring into, levels 1, 2, 3, 4, and 5?
Actually, yes, but the biggest area is still biotech, purely by the quantum. So the AI discovery platforms that are identifying and working on longevity biotech assets, which are going to be related to aging diseases, or as we talked about, prevention or reversing those. They are still taking the lion's share of the capital in the space. Interestingly, there's always a sort of toggle between 1 and 2. And this year, we have seen a lot of neuropharma companies attracting capital. So we've seen the first wave of biotech companies come through with the sort of amyloid tau thesis that they're pursuing. But there's a whole new wave coming through, which we're seeing capital getting behind because, of course, people are in a position now where they're more optimistic that these therapeutic approaches are going to be more efficacious. And on the flip side of that, we are now able to see the earlier and earlier diagnosis of early onset cognitive impairment, which obviously is a precursor for Alzheimer's and so on, that you can get in earlier as well. So I can see it's a matter of time now before we can fix neurological diseases. I can see as a marketeer all the activity that's happening, that these neuropharma companies are going to be highly valuable in the future as well.
I think one concern here in the US is that there's a lot of longevity hype and that there's sort of like a hype cycle going on. And you've got companies like Estee Lauder and Dior jumping on. A lot of beauty brands are maybe using the word longevity in the way they might have used anti-aging before. So I'd love to get your perspective on the hype cycle and what you see some of these brands doing and whether or not it's actually meaningful.
Yeah, so we had L'Oreal come and present at one of our conferences in Singapore. And I was very, very pleased to see the work that they're doing. L'Oreal themselves are bringing out their own longevity brand over this course of this year. And they're applying a lot of the science, specifically senolytic science, which is really cellular clearance, to cosmetics. But they are also pursuing a beauty on the outside and a beauty on the inside strategy. So I think they've still got a way to go to navigate how they're approaching this. But obviously, these brands are very, very powerful. And of course, integrating these brands with the concept of luxury, which brings it back to the wellness industry, which, of course, in some aspects is targeted toward the luxury sphere. I can see that there's going to be a place for this going forward in the future. But I would say that the difference between anti-aging skin therapies and anti-aging therapies that work on the inside at a cellular level, these companies won't be working in that space. They're still going to be kind of working on the fitness, luxury, and the skincare side.
That's great. So I always like to end the episode with learning a little bit about the guest's own longevity practices. So Phil, what are the longevity practices that you find most beneficial?
Well, I went to a meeting yesterday and I said, oh my goodness, I've had 9.75 hours sleep last night. Yeah, I'm a big believer in sleep. Yeah. I do try to keep my stress levels down, which is hard, as you can imagine, doing what I'm doing, but really keeping all of the basics in place. And I think the thing that is very important is discipline. I spoke with a doctor only last week and he said, look, you know the things that you're doing that are either damaging to you or preventing you from doing what you should be doing. And if you have the ability to identify those and then take those out of your life, then you're going to be in a much stronger position. So we're all fighting our own demons. I'm trying to be in a position where, as a Brit, I cut down on my alcohol. So I'm not drinking during the weeks now, but I still drink and have fun at the weekends. But on the basis of the basics, I do all of those sorts of things. We have our own supplements line, and I'm very proud of those. So I take those every day. And of course, I manage my exercise regime and likewise consult with professionals all the time. So I went to Chinese clinics when I was in China last year. And it was very interesting. They identified a lot of heavy metals in my body. So I'm working on that as well. So if you can, and you can afford to do so, definitely put yourself in front of a longevity clinical professional, because they're going to tell you a lot more than you can do by yourself.
Phil, looking ahead, what are the emerging technologies that you are the most excited about? I mean, you see everything. What personally gets you most excited?
So I'm still excited about the GLP-1 agonists because they're going to be a voyage of discovery for all of us. Longevity clinics are going to continue to grow and they're going to standardize, which is great. We'll be seeing more growth factor there. Xenotherapeutics, which has been on the bench for a while, is now proving as a clinical therapeutic approach very exciting and making a lot of inroads into the clinical trials that we talked about. AI is everywhere, so I think we'll be seeing AI agents helping humans much more actively in their basic lifestyle management. And we will see epigenetic reprogramming in the clinic this year. So there's one company, Life Biosciences, who are doing a phase 2 trial in partial cellular reprogramming in the eye. They're one of many that are moving towards the clinic. So very excited to see what's happening there. And of course, policy and regulation is changing all the time. So I can see that there's going to be some very interesting regulatory policy changes with the current administration.
Interesting. Phil, thank you so much for your time today. Longevity.Technology is an amazing website. I urge everyone to check it out. Also, you can follow Phil on LinkedIn. You'll get daily updates about what's going on in the space. Phil, thank you so much for pulling up a chair to the Wellness Roundtable.
Oh, it's been wonderful. Thank you so much for having me today. I've really enjoyed it.
Thank you for joining us for today's episode of the Wellness Roundtable. This podcast was produced by Emily Roberts and Ali Alkiza of Over Lunch. Music was provided by Mindstream. And a very special thank you to Susie Ellis, Nancy Davis, and the entire Global Wellness Institute team. As we wrap, it's important to remember that while this podcast is filled with valuable insights about the latest longevity science and innovations, it is not a substitute for professional medical advice, diagnosis, or treatment. Our conversations are designed to inform and inspire, but should not replace the personalized guidance of your healthcare providers. If today's episode sparked your interest, please subscribe to our podcast, leave a review, and share it with friends. To learn more about the Global Wellness Institute, please visit our website, globalwellnessinstitute.org. Thanks for listening, and we'll see you next time.